Welcome to Unit 5, Lesson 1 of Principles of Health Science. Today we're looking at healthcare careers. So let's start with some of the certifications and levels of training that are possible in healthcare careers. So the first one is a certification. Now, a certification takes 1 year or up to a year to do. And one of the jobs you can get with certifications, with a certification, is a phlebotomist, which you will get if you are in P-Tech. So it takes 1 year. And then there is an associate's degree, which takes 2 to 3 years. And you will also get this if you are in P-Tech because TSA gives you a Associates of Science. And then there's a bachelor's degree, which is going to take 4 years. Usually for you, it'll take about 2 years, or if you go into engineering, it'll take 4 years. But it takes 4+ years to do. And then there is a master's degree. Now, a master's degree takes 6+ years. And this is 4 years plus your bachelor's. So 2 to 3 plus this. And then there is a doctorate degree. Now, a doctorate degree takes 7 to 8 years. And a doctorate degree is a PhD or something like that. Now, there are professional degrees who are going to be your MD, DO, JD. If you think Pharm D is also like that, but that's the pharmacist one. Or maybe it's a master's, I'm not sure. But basically, it's going to be your MD, DO, JD, the medical and law degrees. Those are called professional degrees, and they're a type of doctorate. And then there are healthcare careers. There is a ginormous list, but we're going to speed run them. So the first list are called allied health careers. Allied health careers are health careers that are non-doctors, so not MD or DO. An acupuncturist, we looked at Chinese medicine, and acupuncture is a really big part of it. An acupuncturist manipulates needles to heal pain and deal with all sorts of stuff. So there is an athletic trainer, which is an AT, an athletic trainer. You will hear a ton about this, but this is sports med. So prevention of injury and rehabilitation, diagnosis, all of that. There are audiologists, which handle hearing disorders, right? Audio is sound. And there are gerontologists. Gerontology, geriatric is old, so gerontologists deal with old people. There is massage therapists. You use massage therapy on soft tissue to heal them. Okay, there are MAs, which are medical assistants, and they provide clinical and admin assistance and duties at doctor's office. So clinical, okay. There are OTs, which are occupational therapists. Now, occupational therapists focus on activities of daily living. So they're going to help with fine motor skills and things that are for daily living. So, and then OTAs are occupational therapist assistants. So they basically help OT. And then there are PTs, which are physical therapists, and physical therapists are going to help patients regain strength after accident, injury, or condition. So this is not tasks of daily living, it's after issue. This is going to be your rehabilitation, all of that, but it's not just going to be daily tasks. Like if you have a really bad sports injury, you're probably going to go with a PT. But if you get in a giant car crash and you can't even move around for a super long time, maybe an OT is going to help you. And then the PTA is going to be the physical therapist assistant, so they help the physical therapist, and you'll often see a physical therapist assistant to do a lot of things over the physical therapist a lot of times. Okay, there are going to be respiratory therapists, which are RTs, and these help with breathing. And then there are physician assistants or PAs, and they help diagnose and treat under the care of a physician. So they are like nurse practitioners, which we'll look at, but they have a specific school to go to, specific school, specific job. So basically they work under a physician. Okay, and then let's look at veterinary careers. One of the biggest veterinary careers are veterinarians, so they help diagnose and treat animals. The veterinary tech, the veterinary technician performs x-rays, labs, and all of that testing. And then the veterinary assistant is going to do the feeding and bathing of animals and all of that. And then there are going to be laboratory careers, which a medical technologist, or also called a clinical laboratory scientist. So let's write CLS, clinical laboratory scientist. And these people are going to analyze blood tissues and body fluids to determine presence and extent of disease. So basically, they're going to do pathological work, so analyze stuff for disease. And then there is a medical laboratory technician or clinical laboratory technician, and they assist the MT by preparing specimens and performing routine lab tests. So basically help do prep for MT, which is the medical technologist. And then there is going to be a phlebotomist, and a phlebotomist draws blood. Now this can be for a blood draw or it can be blood donation. Now let's look at dental careers. So a dentist is a specific type of doctorate degree. It's a professional degree, but they're not an MD. And they diagnose and treat the mouth. So teeth, gums, mouth. They're a doctor, but it's not an MD. And then there are dental hygienists, which usually only need an associate's degree, or maybe it's a certification, very short schooling, and they clean teeth, take x-rays, and educate. So these are not going to be the people you first see, actually. Those are going to be dental assistants, but these people take x-rays, they educate, and they clean teeth. So that's what these people do. And then there's going to be dental assistants. These are the people you're going to see first when you walk into the dental office, and they are going to help dentists during procedures, and they're also going to prepare patients. So what they'll do is clean your teeth before the dentist sees you. Okay. And then let's look at emergency medical services. So EMS are going to be your emergency medical services, and they are personnel that are first on the scene to evaluate the extent of medical problems and all of that. So they are going to be first responders. Now there are types of EMS. So the first type is EMS basic, and they'll mostly do life support stuff, so basic life-saving measures. And then there's EMS intermediate, and EMS intermediate will also do what the basic does, but also do IV and intubate, so put in a breathing tube. And then there's EMS paramedic, which is more advanced than the intermediate and can also administer drugs. Okay, and then let's look at medical imaging careers. So the radiological tech is going to do x-ray stuff, and they're going to handle ways to obtain diagnosis of injury, including CTs, which are x-rays, computerized tomography, and MRIs, which are not x-rays. They are going to be your magnetic resonance imaging or something like that. Resonance imaging, magnetic resonance imaging. And they're not radiation, they are magnets that are going to look at the hydrogen ions or something like that, movement, and trace it and display it. Now there is the diagnostic medical sonographer, which uses high frequency sound waves to diagnose. So sonography is ultrasound, I'm pretty sure, to generate images to assist in diagnosing various conditions. So they're going to do the ultrasound. And then there is nuclear medical technologist who uses radiation to images created by a camera that detects radiation that has been administered to patients. So basically this is going to be your PET scan, I'm pretty sure. So radiation given is traced to make an image. And then there is a radiation therapy technologist who treats patients by administering therapeutic doses of radiation. So treat with radiation, so chemotherapy and all of that. And then there's going to be mental health careers, which are going to start with psychiatrist. A psychiatrist is a medical doctor who specializes in psychology or the study of the mind. So that is what they do, and they can prescribe meds. A psychologist is not a doctor. They usually have a master's degree, but they can get a psychology doctorate, which is going to be called the PsyD, I'm pretty sure. Something like that, and they basically are your counselors. Now there can be professional psychologists, which are going to work in academia, and they can be professors, or they can work in the healthcare setting and become counselors. And then there's social workers, so they get a special degree and they basically help with social problems like poverty, family issues, or unemployment. And then a CNA is a certified nursing aide, and they are a basic nurse, such as they do basic nurse tasks, but they're not doing much of the stuff that is clinical. They're going to be doing the bathing, feeding, and all of that. And then there's going to be an LVN, which is a licensed vocational nurse. And these people they work in long-term care facilities, and they do things like caring for the elderly, and they're going to be able to take vital signs. They're going to work in the supervision of an RN. And then an RN is a registered nurse, and they carry out physician orders and assess symptoms, reactions to treatment, and progress, and they are going to treat. So this is your nurse. When you think of nurse, it's an RN. Okay, and then there's a CRNA, which is a certified registered nurse and anesthetist, which administer anesthesia under the doctors. So they basically help anesthesiologists carry out their job. And then there is a certified nurse midwife who helps with OB tasks, such as giving a natural birth. And then there is a NP, which is a nurse practitioner. And these are basically doctors, but they are nurses with a few restrictions. And the restrictions vary by state and all of that, but they obtain histories, they will do your physicals, and they carry out most tasks doctors can. They can also prescribe medications and all of that, but they have a master's degree and are nurses. And then there is a pharmacist, which is going to be pharmacy careers. And the pharmacist will dispense medication, and all of those are prescribed by doctors. So they take care of meds. And then the pharmacist technician works under the supervision of the pharmacist, filling prescriptions, labeling medicine. So they basically help pharmacists. A biomedical engineer will design medical technology and devices to help treat problems. So basically they're going to design things. And then the biomed equipment technician is going to inspect, maintain, repair, and modify these instruments to make sure they are safe and able to be released. So they basically quality assurance check these people. So QA testing is their job. And then there are forensic scientists who look at all the causes of death, and they determine the manner or cause of death. And then there is an EKG technician or an electrocardiogram technician. And an EKG tech will look at the EKG. They will operate the heart electrical system. And then there is a electroencephalographic technician, which is the brain. So they will look at electrical activity for the brain using the probes and all of that. And then there is a surgical technologist who will assist the surgeon before, during, and after surgical procedures by preparing the patient and maintaining surgical equipment. So they will prep the patient, and they will prep OR, and they will help surgeon. And then a perfusionist is going to basically act as the heart in open heart surgery. So they will operate the machine that takes the place of the circulatory system. And then an ophthalmologist is a MD, but they specialize in the eye, and they will carry out surgery for the eye. They will treat, look at the eye, help all of that. An optometrist is not an MD, and they go to optometrist school, and they can't do surgery. So can't do surgery, and they are not. And then finally, we have an optician. An optician will care about eyeglasses. So these are the people who are going to help you pick out your glasses, frame, look at the prescription from your optometrist or ophthalmologist. So eyeglass people. Now there is specific criteria for physician careers, and physician careers are going to be your MD and your DO careers, so medical doctor or doctor of osteopathic medicine. So what are some characteristics of MDs and DOs? Well, MDs will care for the ill and help and diagnose, prevent, and order tests. So basically help ill. And they will start by going to undergrad. So they will do 4 years of undergrad or their bachelor's degree. And then after these 4 years, they will take what's known as the MCAT. The MCAT stands for Medical College Admissions Test, and a good score will make you competitive when you go to medical school. And they will go to medical school for 4 years, and this is when they'll take their boards, some of the steps of their board exams, and then after med school, they will go to residency. Now, residency is when they will specialize, and residency can be anywhere from 2 to 7 years. I don't know what 2 years is because it's usually 3, even for family medicine, but residency can be a long time, and it will be when you specialize. So if you become a cardiologist, or you become a pediatrician, that's when that will happen. And then there will be a fellowship. it depends on the specialty, but some specialties will need fellowship, like oncology or surgery. Basically, the only thing you really need to know out of all these notes are the ways to start off your career. So these are the most important things you need to know because this was on my midterm. And then the final thing would be the path to becoming a doctor. That wasn't tested, but I think it's important to know because many of the people will be doing presentations on how to become a doctor.